Now, when it comes to undiagnosed conditions, so those individuals who fail to obtain medical diagnosis, some of the best diagnostic yield is people whose conditions exhibit high genetic heterogeneity. What does that mean? It means those are conditions that produce same outcome, but many different genes can lead to that outcome. So that's where genetic testing has some of the best diagnostic yield. It also serves very well for conditions that have unexplained presentation. So we don't see a specific familial pattern there, and there is no potentially easy environmental explanation for why the condition is present. And finally, especially conditions that suffer from intellectual disability, they also have very high diagnostic yield. Another one that is actually fairly commonly diagnosed now is autism. So being able to diagnose specifically what type of autism can also have large benefit, especially those that have comorbid intellectual disability or syndromic features. And the top three of these points refer to conditions that we would call undiagnosed conditions, or in other words, rare diseases. So what are rare diseases? Rare diseases are conditions that are very infrequently found in people. We're talking about in the order of maybe 5 in 10,000 people might have one specific condition. However, here is an interesting twist to this story, and that's the fact that approximately it's estimated that there's at least 8,000 of these type of medical conditions or genetic diseases that are very rare, but collectively, if you put them all together in our population, they might affect as much as up to 10% of our population. So while the conditions themselves are rare, the incidence collectively of all of these conditions in our population is not. So actually far more people are affected than we realize. We often don't know this because many of these conditions might have only mild symptoms in presentation, and many do not. Those that have more severe clinical symptoms oftentimes are chronic and progressive, and those specifically can dramatically benefit from early diagnosis because it can either lessen or delay the complications of that specific disease. And this is where genetic testing is of such tremendous value because it can provide very rapid diagnosis. Oftentimes it shortens time from onset of symptoms to diagnosis, um, dramatically shortened using DNA testing as opposed to other clinical approaches. So let's narrow down on what are benefits of early diagnosis, such as can be obtained from medical DNA testing. And this is standard not just for the target group that is undiagnosed diseases, but for anyone receiving early diagnosis from medical DNA testing. So the most common benefit, in fact, the one that is most likely to be witnessed is optimal management. The second best benefit would be to learn about supportive therapies. So these are therapies that not necessarily treat the condition at all, but they can support the management. And we're talking about specifically drugs that could help lessen the burden of the condition. And then finally, would be the final benefit is learning about targeted therapies or therapies that are used to treat the condition. This is the biggest benefit, but it's also the most rare to be experienced. So to give you some examples of what kind of diagnostic yield we are currently observing with individuals who are categorized as undiagnosed and then undergo genetic testing and see how often they can benefit. We can turn to data published by the Undiagnosed Diseases Network in the United States. This is a network comprising some of the best and largest medical centers in the United States. I believe there's 12 of them in this network, and that includes Harvard. And in fact, this network and the data collected and presented here comes from Harvard. And this undiagnosed disease network itself is also part of even a larger international network as well. So this data is coming in from medical centers from all over the world, and so these benefits are very real medical benefits. So let's see what they're observing. The data that just been published in January, so the latest data, is that of all the candidates that have been submitted for analysis, approximately 30% of them have obtained diagnosis as a consequence of analysis of their medical records, and about 80% of the time this was specifically due to use of exome or genome sequencing. Now, when exome or genome sequencing was used, the vast majority of the time, a specific point mutation was discovered in the DNA, meaning one mutation was uncovered and found to be responsible for the disease. But there's other type of mutations that could be uncovered as well that are more complex than this. And one of the common problems that is also discovered is that the amount of the gene itself can change. So the copy number of the gene that is affected is changing. So it is either increased or decreased. And as a consequence, when you increase, so imagine if you're going from having one copy of the gene and then you suddenly duplicate it or triplicate it, then you're producing more of the product of the gene than you normally should be, and that could also drive the clinical outcome. So about 7% of the time, this is the reason that is uncovered in people who suffer from undiagnosed disease based on the results observed with this American network of undiagnosed diseases. What is also very interesting is the power of DNA testing, and in the process of last few years, when they've analyzed all of this information, the researchers and the medical scientists, they discovered 30 new conditions, meaning these conditions previously were unknown, and because of the genetic sequencing, they were completely 30 new diseases were categorized. So you can see the power of DNA sequencing in terms of uncovering what might be the problem with a given patient. More specifically now, when exome sequencing was used, the diagnostic yield was increased to about 32%. And when it came to genome sequencing, it was about 18%. However, what I wanted to add here is that the vast majority of this number comprised patients who failed to obtain diagnosis using exome sequencing, so failed to obtain diagnosis looking at their genes only, and only obtained their diagnosis once the broad genome or all of the DNA, including DNA outside the genes, was analyzed. So the true diagnostic yield of genome sequencing is more closely would represent by adding those two numbers, so approximately 50% of the time. And that's why I presented that number previously, that full genome sequencing can provide diagnosis approximately 50% of the time. Analyzing the type of patients that obtained the results. Half of them were female. About 2/3 of them were individuals under 18, so children. So you can still see that a large representation of those who benefited from DNA sequencing were adults. Approximately 2/3 of them were Caucasians, so that's also a very nice number because this represents more closely represents true demographics of our society. So that's nice because this shows that this is other ethnicities are also studied and can also obtain benefits from genome sequencing. That's important because the vast majority historically of medical analysis is oftentimes on Caucasian ethnic group, and there's a very strong push currently in medical sciences to include other ethnicities as well so that it can broaden our understanding of diseases and how they relate to ethnic groups. You can see that neurological symptoms is one of the largest symptoms observed in individuals with undiagnosed diseases, and approximately 9% of those who obtain diagnosis suffered from multiple birth defects. And another interesting and perhaps surprising result is the fact that about 3% of those individuals who obtained result had more than one genetic condition. So that it was a confluence of multiple diseases that produce very complex pattern of clinical symptoms. So you can see how sometimes it can be extremely difficult for a doctor to be able to diagnose an individual just by clinical symptoms alone, especially if there's more than one disease involved. So you can see this is not rare. This is in fact common enough that it was observed in 3% of individuals. For the report, when the doctor obtains the report, there's 5 types of genetic outcomes that could be considered. There's pathogenic mutations. Those are the ones that are confirmed to lead to the disease, meaning there's a large body of evidence already accumulated to be able to definitively state that this mutation is responsible for the clinical outcomes. The other category is likely pathogenic. It just means that the body of evidence is not as strong as for the category above that. Together, both of these are very significant, and it means the doctor has to act on that, meaning the doctor has to analyze this information to determine how the patient's medical management should be altered. The other genetic outcomes could include what we've referred to as benign mutations, meaning they don't have impact on the clinical outcome. These are never reported because these would literally number in millions of different mutations that are found, that could be found in our genomes, and they have no impact on our health. Likely benign is similar category, and then finally there's what we refer to as VUS, or variants of unknown significance, and these are not mutations that a doctor should be acting upon, but they could be significant, and they usually are not reported. VUSs are usually not reported to doctors. Sometimes they can be if they're very suspicious, and if they are ever reported to a doctor is not supposed to use it for medical management of the patient, but they're very important for subsequent follow-up because VUSs can be switched into either benign or pathogenic category later on in the future. So anytime you undergo medical DNA test and you receive pathogenic or likely pathogenic results, that's very significant. That means a doctor should act on that. It also means you should undergo genetic counseling, and this is the type of result that should never be dismissed. Finally, I will conclude this section on the differences between private testing and public testing. The benefits of private testing is that typically they are much faster, especially in our Canadian setting. Because we are public healthcare, it means there's a limited access of resources, and there can be sometimes long wait times for results. Anyone who has gone through our system, Canadian system, especially as it relates to obtaining genetic diagnosis, can relate to this. Typically, private testing are far more comprehensive, meaning they will analyze many more genes than what will be available through public setting. And because of that, such tests will be more accurate. That doesn't mean that the tests that are offered through public testing are not accurate, but because they do not analyze as many genes, they are more likely to miss diagnosis or to miss information. And if you increase the number of genes you're analyzing, then you increase the chance of obtaining a diagnosis in some obscure gene, and therefore, as a consequence, you will increase the accuracy of the test. So this is what I mean by that. Public testing, on the other hand, relies on cheaper tests because of the limitation of funding. Also because of that, usually the technology that is used in a public setting does not match the quality of technology that could be offered through a public setting. So these are important considerations for anyone thinking of medical DNA test. Of course, Genomics offers access to private testing, but all of the information I'm presenting today is for the purpose of education. It doesn't matter which company is being used. This information is for a consumer to be better equipped to make up their mind on what they want to proceed with.